Hi, my name is Keri, and I'm an esthetician here at Meraki Medical Esthetics, and I perform laser hair removal. So I was going to give you guys a quick little lowdown about what to expect from laser hair removal before the treatment, during, and the aftercare instructions. So today I'm going to give you a little explanation of how the laser works. So what we do is we choose the laser depending on your skin type, which is a Fitzpatrick scale from very pale up to dark skin. And what we do is we will gauge that. You want to come in fully shaved because we want the laser to have no interruption between the skin and the laser beam itself. We want the laser to penetrate deep underneath the skin layer to help stop the blood flow to the hair follicle. And that is when you get the best results, and when the hair is in the best growth cycle for the laser removal. After the laser treatment, there are many steps you take at home so that way you do not have any irritation or any problems. So I'll get into those in a minute as well. But during your treatment, what you will feel is there is a little bit of heat, but the base of the laser is cold. So when it touches the skin, you'll feel the coldness and then almost like a little elastic flick right onto the skin. And that does every spot where your hair is under the skin. You'll feel a little more intense at the beginning because you have denser hair at that moment. And then after the first treatment, every other treatment usually does get a little less painful as the hairs start to either not grow back or get finer or thinner. So for 24 to 48 hours after your treatment, there are many things that you want to avoid. One is exercise. You don't want to have excessive sweating in the area. You want to avoid hot showers, any baths, saunas, steam rooms, anything that puts any kind of heat to the area because that can be extra irritating. You will have a lot of the time some tingling and redness, which is completely normal and should subside within 48 hours. You can put ice on the area. You can put soothing aloe. You can put some hydrocortisone if you feel a little itchy, but you want to use nothing fragrant, no fragrant lotions, no harsh chemicals, no exfoliants in that area, just because it is sensitive. And you also want to stay out of the sun for at least 48 hours. And if you do have to be in the sun, use any kind of sunscreen with a SPF of 30 or above. So then once the skin has calmed down, you will see there's a lot of times there's called a shedding period where you will see the hairs actually fall out. You want to let them fall out on their own. Do not pull them out because you always need a hair follicle there to kill for the next laser treatment. If you do see them shed, it is very normal to have a hair come through right after. And that is again why it takes 6 to 12 treatments, because you have to hit the hairs in every growth cycle. You would want to contact us if you do have any of the following symptoms more than 48 hours after. Any severe pain in the area, blisterings, any open wounds, or any sign of infection. It's very rare that that can happen, but it could, so we'd always want you to contact us with any questions regarding that. So the areas that can be treated with laser hair removal for females include anything from the nose down. So we can do the upper lip, the cheeks, the chin, neck. We can go around the nipples. We can do underarms. We do full Brazilians, which include the butt area. You can do it without. It's not anything that's necessary if you don't want it. Legs, toes, feet, fingers, everything can be done for women. For men, same idea. Obviously, with their facial hair being a lot thicker, it could take more treatments if it is something they wanted to permanently remove on the face. But I do find a lot of men do their neck. We do full t-shirt front and back, chest, back. We can do buttocks. We can do the male genitalia if needed. Legs, anywhere can be done with the laser hair removal. If you have more dense, thick hair, you usually will require more treatments. But again, 6 to 12 is the best average to start all laser hair removal treatments. And so for all my women that have PCOS or any kind of hormone imbalances, I know the doctors will tell you that laser hair removal is not good for you and will not work. But I can tell you by my experience of treating many women with the hormone imbalances that they've had some great results with it. A lot of them will report that they now have to shave once a week instead of once a day. A lot of them have got a lot finer hair, thinner, and a lot have had a lot of areas be almost permanently gone. So it's something to definitely look into. It does take a little bit more treatments a lot of the time because hormones is one of the biggest cause of hair growth, but it's definitely something we can work with, and I've had great results with the females that I've treated with hormone imbalances. So please make sure to follow us and subscribe to our YouTube channels. You can also follow us on all our socials. All the links are below. And if you have any questions regarding laser hair removal, feel free to reach out to us at Meraki Medical Esthetics, 781-872-1150.